Yeah.
And when I was writing my book, I came across a study that said only about 55% of audiology clinics actually test for sound and noise, meaning how does your hearing change when you've got lots of background noise happening? That has been my particular form of hearing loss since I was 18. And so obviously I've paid attention to that. But I know that when you say prescription hearing aids, talk about this process of what do you bring a patient through as far as diagnosis, and then what goes into a customized prescription hearing aid different from your over the counter hearing aid, which is, I don't know, I almost
Yeah.
liken it to like a pair of cheater glasses, you know?
Exactly. Exactly. Which is why I could not go get cheaters because I would have, I had to go get the right prescription ones. um, so that's an amazing question, and that's an interesting stat. Most of the data I've looked at is actually way more disappointing. One of the biggest studies done in audiology found, and it truly pains me to even say it in a forum like this, but it says that 85% of audiologists never measure your ability to hear in noise.
Okay, well, you can correct me when I come across as the optimist. That's fine.
Now, look, I'm sure there, but no, seriously, I'm sure there are studies. Again, it's one of those things where there's a range, but the most comprehensive study that was done
Hmm.
found that about only 15% do speech and noise testing, or flip the coin and say 85% don't. Either way, either 15, 55, they're both very disappointing numbers because the number one complaint in 99% of all patients isn't I can't hear, it's I struggle to follow a conversation in background noise. And the thing that I find most offensive is that would be like going to the doctor and saying, look, my leg hurts. And all they do is an x-ray of your arm. It's like, did you not listen to me? Like I just told you my I can't hear a noise. How do you quantify that ability by just having me raise my hand when I hear a beep? It's a wild concept. And so I appreciate you mentioning the Excellence in Audiology Network. We're across the nation and international. I think we've approached 260 plus clinic locations, assuming the web guys are keeping up with the numbers. But I know we're above 260 locations, so there's probably one close to you if you're listening. We have a very rigorous, evidence-based 7-step cognitive screening and diagnostic evaluation. I basically explain it to my patients as we leave no stone unturned. Whatever your complaint may be, and even if you don't necessarily have the complaint, we're still going to test for it. And I want to highlight a couple of things. Yes, we're going to test your ability to hear in noise. We're also going to measure your clarity, because that's what a lot of patients say. I can hear my wife yelling for me from the other room, but I can't understand what she's saying. Or my favorite is, doc, I can hear you, but let me put my glasses on so I can hear you better, right? Because they're just trying to read my lips and fill in some of the missing pieces. It's not, hearing is not a light switch where you can either hear or can't hear. There's that big gray area. So we measure clarity, we measure your brain's ability to handle words in complex situations. And for me, one of the most important things we do is we do a cognitive screener, FDA cleared cognitive screener on every adult patient who comes in saying, I can't hear a noise, I'm struggling, or I have tinnitus. And the reason is because a great study came out, published in the Alzheimer's Association Journal just a few years ago, that said if you have poor ability to follow speech and background noise, you may be 60% more likely to develop dementia in the next 10 years. It may, like, basically considering it one of the earliest symptoms of cognitive decline is your inability to hear in noise. And so it's really important